Hey everyone, my name is Rachel and I am an accelerated BSN student. Just wanted to give an update because the last time that I did a vlog, I think was my first week of nursing school. So I am now 1 month in, which is kind of crazy. So my program is 16 months long. So now I have 15 months left and I'm going on week 5 on Monday. That's my birds. I love my birds. They keep me company when I am doing all my homework. So let's see, I want to give an update. I also want to know if a regular BSN program has this much homework, but let me show you. All right, so this is my crazy planner, but basically these are all the assignments I have to do for the whole week. And the little sticky notes are other chapters or any other readings or videos that I need to watch for my modules. But basically, okay, so like just Sunday alone, September 22, I have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 homework due. And then Friday I have 2, Saturday I have 1. So let's see, for next week, Monday I have 4, Wednesday 1, Friday 2, Sunday. So I am averaging, and these are not all my homeworks. I have to do the Safe Medicate is a different website. So we use Safe Medicate here, and we have to do modules there as well, and quizzes that we have. I did, baby. So we have to do modules and also quizzes that we have to get 90% on or above, or we have to redo it. And besides this, we also have Evolve, which are usually like 10 to 20 videos we need to watch. And we also have to do the quizzes before we go to lab, and we have to pass on that 80% or above, or we won't be able to go to lab. But this one is actually really cool because, so right now we're working on the essentials collection, but to give you an idea, it's just been like, let's say, adding items to sterile field, cleansing enema, ear medications. So this week I have done, what is it? We're learning injections is what I'm meaning to say. So let me flip the camera. Okay, so far I have done 1 exam, which I almost failed, but I didn't. I passed. My program, you need 75% or above to pass, and no shame, I got a 77, but I passed, so it's okay. And I've done 2 skills checkoff, which we call validations. We've done vital signs, which was really nerve-wracking, even though I do it all the time for work. But anyway, and we did PO medication, which that one was so fun. I did really well on that. And in a few days, I'm doing my medication for injections. So we're doing intramuscular and also intradermal, which I practiced today with a few classmates in lab. We had open lab in school, so I went to meet up with them. And let me show you what I got from Amazon. Okay, this is kind of a mess, but I got the fake skin sponge. So like if there's a lot of water, I can just squeeze it out and reuse it. And look, I got practice needles, the vial, or like the syringes. It's pretty cool. So I've just been practicing my IM and also my sub-Q and practicing all the sites that we need to know. We have a validation sheet that we need to follow, and I'll actually show you that. Okay, so for example, this is for the sub-Q injection administration. This is the validation sheet, and I highlighted the stars because if we don't do the stars, you automatically fail. And I think you get up to 3 attempts, but the first grade that you get stays on the grade book. Second and third is just pass or fail. So if you get a 20 on the grade book, that's gonna bring down your overall score. So I always aim to do good, even though we have a few tries. But I highlighted the ones that we have and must say no excuses or we're gonna fail. But like, let's say it's important to do hand hygiene, check allergies, Of course, verify patient ID name and birthday, verify it with the MAR as well. We have the correctly preparing medication and how to do that. Checking medication with the MAR 3 times, which is actually not too bad to do. And yeah, so like, let's say this is for IM. Says verify healthcare provider, perform hand hygiene, check allergies, to identifiers, and you have to verbalize like the landmarks for IM injection. So the deltoid, the ventrogluteal, the vastus lateralis, and I just need to practice all these. But so far, I'm a little confident. I just need to kind of know more of what I'm gonna say. Like, one thing is we have to also verbalize how to document. So it would be, let's say, to the date, the time, and then blood glucose is 140, administered insulin per MAR, left upper quadrant, patient tolerated well, instructed to call if signs and symptoms of hypoglycemia occur, and then it would be our name, and then nursing student as her title. So need to practice on this weekend. Our validation is Monday. Today is Friday. So another thing I did was buy this Next Gen NCLEX RN because though I passed my exam, I wasn't happy with my grade, and me and my teacher, I had an appointment with her to kind of just talk about the exam and what I did well, what I didn't do well, and we have came to a conclusion that the test style is what I'm having trouble with, because basically nursing tests are all priorities, or like, what will the nurse do, what will the nurse not do, just kind of the testing style I'm struggling with. So I figured this might help me. I did some research and I read some Reddit posts, and a lot of nursing students got this and was able to help them get better grades on their exams because they did a lot of practice questions. I believe this has about 2,000 practice questions, so not only will it help me with my nursing exams, will also obviously help me with the NCLEX. And this was only $50 on Amazon for a brand new one. Can you tell me why you're seeking health care today, Miss Young? Planner, and I'm watching a vlog while exercising. She's keeping me entertained. That's Krista though. She does nursing videos as well, and some lifestyle vlogs. Sorry, I'm out of breath. Okay, trying to do 5 to 10 minutes of stepper whenever I got tired and bored of reading or doing my homework. So here we are. Today is Saturday. I made some waffles with some eggs for breakfast, and I'm gonna try and knock out a bunch of homework today. Okay, so I'm looking at my planner so I can plan what I need to do. The highlighted ones are the only ones I have left to do, and some of these are due tomorrow and some are due Monday, but I like to get everything done by Sunday because Monday I have class and I do not feel like doing homework right after class because my brain is usually fried after that. Anyway, I just need to do a PE write-up of head, neck, and lymph nodes. So I'll probably do that on my husband or my mom and have them sign that. I need to do a sample care plan, which I'm really excited about. So we have to do the nursing diagnosis, and these are samples of nursing diagnosis that my school gave us. So nursing diagnosis is very different from medical diagnosis because we do not medically diagnose anyone. That is a doctor's job, but we can do a nursing diagnosis. And these are some examples of it. And then this is the sample care plan. But I did my draft here. I need to pick a case study and just kind of start filling this up. So we need to do the nursing diagnosis, which is the hypothesis, the rationale for the hypothesis. A goal is going to be a short-term goal, 3 measurable behaviors, taking action, I know we need to do our evidence-based practice rationale, and we have to include our sources and our evaluation. So I'm doing my lab videos that I need to watch and take quizzes on before I go to class tomorrow. But we are learning IVs, which is so exciting. I'm probably gonna close out the vlog here, so let me give you a little view here.
Above the proposed IV insertion site. To avoid bruising the skin or occluding the artery, feel a quick stick. Insert the vascular access device. Bevel up at a 10 to 15 degree angle.